There's been a lot of change with hip and knee replacements over the past 10 years, and so we've tried to bring the inpatient stay down, and most patients really like that. So 2 to 3 days for most hip replacements. Knee replacements sometimes stay a day longer. In terms of mobilisation and getting up and walking, it will be the day after surgery, but returning to sporting pursuits and this type of thing could take up to a year. 6 weeks is generally the golden period for returning to driving and getting back to normal life and maybe starting to lose the walking aids that you've been using. Well, the risks of hip and knee replacement are fairly similar between the two groups. Infection is the main risk that patients worry about, which is normally about 0.5%, and we decrease that by using intravenous antibiotics at the time of surgery. Thrombosis, which is a blood clot, is also a significant risk, and we use some form of drug, either an injection or a tablet, to keep the blood thin. Many patients worry after hip replacements that their legs may be different lengths, and we try to make sure that the lengths are fairly similar afterwards, and there's a risk of fracture or dislocation in the early days following surgery as the muscles are weak around the new implant. There are some exciting new developments in hip and knee replacement. Patient-specific implants where we mimic the anatomy of the patient's own joint by using a CT scan and designing a custom-fit implant for the knee. The use of computer navigation to use sensors on the patient, again with a preoperative CT scan, and an advance from that is now using a robotic assisted operation to make the cuts in the bone very precise.